If you're dealing with SI joint pain and you've been getting massages or adjustments to fix it, you're probably stuck in a cycle that never ends. I'm here to tell you a little secret that no one else is talking about. You don't need to stretch it, crack it, or rub it out. You need to strengthen it. Now let me show you why. The sacroiliac joint, which is here, is also called the SI joint, and it connects your spine to your pelvis. It's supposed to be super stable because it's a huge joint. It doesn't really move at all. But when the muscles around the joint aren't doing their job properly, it can get irritated. Not torn, not misaligned, not out of place, just irritated. This is why you feel pain in your lower back, your butt cheek, and you get this especially when you're walking, standing, or just changing positions in bed. Look, I get it. Having things like massage and adjustments, or even having someone walk on your back can feel great in the moment. But that's where you can get some quick relief, and it might make you feel a little bit better, but they're not fixing the problem. But here's the thing, you're not addressing the root cause of your SI joint pain. The SI joint doesn't need more movement or pressure, it actually needs stability. Every time you go for another adjustment or massage, you're just putting a temporary band-aid on the issue. You're not solving it. You're pressing the snooze button on a real solution, which is strengthening and stabilizing the muscles that support your joint. You are treating a stability issue with a mobility solution, which simply doesn't work. See, the SI joint relies on deep muscles to stay supported. So these include things like your big glute max muscle here, but also the smaller muscle that runs up and down the other side of your spine, which is called the multifidus. It also relies on the support of the abdominal muscles, the pelvic floor, and your diaphragm. So when these muscles aren't working together, the SI joint loses the support which it needs, and that's what can result in pain and discomfort. If these muscles aren't doing their job, whether it's because of an injury, sitting for long periods, or simply not training them enough, the SI joint doesn't get the support it needs. As a result, the joint becomes strained. This added strain is what leads to the pain. Now, without proper stabilization from those muscles, the joint can become irritated and painful, leading to discomfort that doesn't go away until the root cause is addressed. Now I'm going to show you two exercises that will help strengthen those muscles. Okay, we're going to focus on these. We're going to move it slowly and we're going to move purposely. The first one is what I call rockers. This comes from Bam Lionheart and his movement called primal movement. All right, what we're going to do is we're going to put our toes together and our knees about shoulder width apart. I'm actually going to try and get the shin bones down onto the ground. So I'm pushing down, and then once they're down, I'm going to move them apart as well, but not moving in real space. I'm just putting some pressure to switch on my butt muscles. From here, I simply move backwards and forwards, keeping my lower back with a little bit of extension in it, a little bit of an arch in it. If that doesn't hurt anywhere, then this is fantastic. If it hurts my front of the hips, which can commonly happen with tight hips, you just put your hands onto a little stool or something like that and just go a little bit higher up. Okay, you're going to do about 10 or 15 of these rockers like this to get the glutes activated, but then we're going to focus on one side. So what I'm going to do is I'm going to shift my hips to one side and then push back at a 45-degree angle thereabouts. So I'm going to show you what that looks like from the front in a second. All the while, I'm pushing my knees apart against the resistance of the mat. So I'm focusing on one side and I'm beginning to feel a burn deep into that right glute. All right, so what it looks like from the side is this. We're here, I push my hips out to my right and then back 45 degrees, keeping the shin bones pushed down into the ground. I'm going forwards and backwards. I can do this for a number, let's say 20 repetitions, or I can do it for a time, anything from 30 seconds to 1 minute. After that, you shift across to the other side and do the other side. It doesn't matter if you've got pain on one SI joint, you need to do this exercise on both sides. Next, we're actually going to get you standing up and doing the same movement. Okay, for this next movement, we're going to do the same thing, but standing up, okay? So the setup is to actually go onto the outside of the feet and then bring your big toes down and in. So your pressure is on the outside of your heels and going down in onto your toes. This raises your arches up. From here, I'm trying to push my feet apart, but they're not going anywhere because of the resistance of the mat, but that switches on my glute muscles. Okay, so now I need to get the breathing, the pelvic floor, the diaphragm, and the lower back muscles working. The way we do that is we simply hinge at the hips. I like to imagine someone's put a lasso around my pelvis and they're pulling it backwards. So I'm getting a nice hip hinge here. The reason I have this pole is because I want some support. But all you need to do is hold on to the back of the chair, the couch, or even onto a wall like this. But for you to be able to see me properly, I'm just going to hold onto this pole. So I'm pushing my hips backwards. I'm keeping my lower back arched. I'm tucking my chin in. My spine is nice and aligned. I've got my heels pushing outwards and my big toes pushing down and in. This already is creating pressure through my butt. And now from here, I'm going to push this hip backwards and to the side. So I'm doing that same movement. And this is called a drop-in. All my weight now is on my right foot. If I want to, I can just simply lift up my left foot and just put a little kickstand behind me here. I'm going to go backwards and a little bit forwards. I'm not necessarily going all the way up. I'm just going backwards till I feel a stretch in my hamstring, my glute switching on, and a little bit forwards. This is creating some really nice tension and pressure into my glute. Now with breathing, I want you to breathe in deeply, slowly for about 4 seconds, hold for a couple, then breathe out. Okay, so it's going to be this is getting our diaphragms, both the pelvic diaphragm and our breathing diaphragm to work together. But also, as we breathe out, we're forcing the abdominals to contract as well. So getting a really nice glute exercise, lower back exercise, diaphragm exercise as we do this. For sets and reps, you can do a time on this. I would do 1 minute either side and repeat this 3 times through. And once you do this for 2 or 3 weeks, you're going to feel your butt get stronger, your lower back get stronger, and ideally your abdominals getting stronger as well, all protecting your SI joint. Your SI joint isn't broken, it's just lacking support from its friends. Once you start training the muscles in the right way, your pain will fade away, not just temporarily, but for good. You don't need another appointment or another quick fix. What you need is a clear plan to strengthen and stabilize your body so you can take control of your pain and feel better in the long term. Now, I want you to stop chasing temporary relief. It's time to build real lasting strength. Now, if you like this, don't forget to subscribe and give me some love in the comments. But also, you might like this video here.